Colombo, Sri Lanka. I'm Dr. Pamod Damrikon from Health Informatics Society of Sri Lanka. We warmly welcome you to the 5th Sri Lankan eHealth Hour, organized by Health Informatics Society of Sri Lanka in collaboration with Asia eHealth Information Network. We have to see several experts in health informatics, including medical officers of health informatics, academic staff of universities, as well as postgraduate students in health informatics joining for our webinar today from all over Sri Lanka. We all welcome attendees from Asian region, including the members of AHIN. Thank you all for joining. This hour is an online knowledge-sharing session where experts in health informatics will be sharing their knowledge and experience on topics of interest in real time using WebEx platform. We'll be usually having a presentation by a panel of experts, followed by a question and answer session where attendees can actively involve. Sri Lanka Health Hour will be held fortnightly on 2nd and 4th Thursdays of each month between 2 to 1 p.m. Moving on to today's session, I'll briefly mention a few things to note while using WebEx platform. Once into WebEx, the panel is where you shall see the content presented by the panelists, including PowerPoint presentations, videos, etc. The right panel contains some useful tools. If you click participants icon, it will show all panelists currently logged into the event. Q&A used to ask questions from the panelists. You can feedback during the presentation by clicking on applause, yes, no, too fast, too slow, and laughter buttons. Your phone will be automatically muted once you join as an attendee. Your microphone can be unmuted upon request should you wish to join a Q&A session with audio. If you are anxious in receiving audio during the webinar, please log out from WebEx platform and try to re-log in. The topic is Enterprise Architecture for Health by Dr. Subodha Manoj, Dr. Medical Officer of Health Informatics. He is attached to Ministry of Health in Sri Lanka. He gained his primary degree in Bachelor of Medicine and Bachelor of Surgery from University of California. He has further received his Master's degree in Biomedical Informatics in year 2011 from University of Colombo. He is also an Archimate certified expert in health informatics, and we are lucky to have him as a panelist for our Sri Lankan eHealth Hour. Over to you, Dr. Subodha.
Thank you, Ahmed. Good afternoon. Okay.
Subodha, we can.
Thank you, Pamod, for introducing me and giving this opportunity. Today, I will small discussion or the representation on the usefulness of enterprise architecture in health context. As we know,
Dr. Subodha, could you please check on your screen because we currently cannot see your screen.
Oh, a minute. I'm looking
please yes, let me check. Yeah, from the end I can see that the controls have been assigned. Could you please click on share button in your screen?
Can't see that.
Let me check again.
Oh, give me a minute. It's working now.
Right, yes, now I can see. Thank you.
Okay. You know, health is a big industry, also big enterprise, and also it keeps on building a complexity, and it makes it hard to build. And the health system has many processes. As the system evolves, this number of processes will increase. And for the reason of easy management, we divide the processes into different divisions. Divisions in the health enterprise will give to fragmentation. And the problem is the fragmentations created within the health enterprise might not communicate or coordinate with each other. So now it's about interoperability or integration of these different things. I think that's where we want to consider enterprise architecture strategy, engaging this complexity of the health enterprise in a better cases. To this, I think that is the entry point of enterprise architecture into the system. I don't know. I have mentioned few of these divisions which exist in the health system. By using a enterprise architecture as a blueprint, we can code of these divisions in an integrated environment. Now, I want to have some idea about enterprise architecture. Again, system architecture. System architecture, we talk about individual systems. These systems, each of these systems might have a common goal, but we think about a single system as a unit. It's like building my own house. I own that house according to agreed plan, which will be developed by an architect. But the day I start building the house, I do not have any return of it. Unless finish building it, and until I occupy that house, I can't get any benefit or any gain from the house. Once I start building the house, when I go and reside there, the building process should stop. And I command all the people and tell them how, what to do, when to do everything. I have the command and control. And the will be based on best practices. Best practices means we decide how many rooms should be there, how the water supply should come, everything will be based on the best practices. When we compare it with the enterprise architecture, we talk about not a single house, we talk about a city or country. Units with environment will have many participants or communities. Will be stakeholders in an enterprise. Who is a stakeholder? We find in enterprise architecture, we define the stakeholder as a person or the entity who plays key role in the enterprise. When we create the new requirements, when we want to change the plan, overall objective might get bigger. So we need to keep on gathering the requirements, and we need to go. And other thing is, when in nature we see incremental results, and in 1 month's time we will get some improvement in the whole enterprise. In the next month there will be more like that. Another thing is, enterprise architecture is a continuous process. We cannot say that we have completed enterprise practice of enterprise architecture and we are going to stop from there. It's a continuing that we have to do throughout the life cycle of the enterprise. These stakeholders say what they want and what they want to achieve through practice of architecture. I think it's a continuous challenge. It never ends. Challenge never ends. We have to continue with it if we start. Are there any clarifications that you want to make?
No, we have not received any questions. No, so we have not received any questions. Yeah.
My voice is clear?
Yeah, quite okay, but we have some occasional interference, but okay, much better than how it was.
Okay. Our aim at this point is to improve the health system. We are not going to enterprise architecture. What we want to do is to improve the health system. What we do is we use enterprise architecture to improve the delivery patient. As we said earlier, in the system there are many processes. And there are different outcomes. It benefits from the health system in a different way. That is, we want to improve business service delivery or the healthcare service delivery. And how are we going it? We have to integrate these different processes in environment. It means different individual system to a common outcome. You procure a drug, or say that we want to procure new medical equipment. All different divisions should act in a integrated way. They communicate with each other seamless where the information flow is say that our system is functioning very well, and the flow of business functions of the system are very smooth. Then we have a health system which is responsive to change and supportive of business strategy will get when the health system will be supportive of its business strategy. And we will preserve, or the organizer will preserve more time to, rather than just carrying it forward. He will have more time for innovation and improvements. And the business processes will be more consistent. And makes them reliable and secure. And the business operations would be efficient, and IT operations would also be efficient. We want to invest in the health system, we can get a better return of it, because we know our health system very well, and we know the weaknesses and strengths. If we want to where to invest. Procurement will be cheaper, simpler, and faster. Are we getting any response from the participants?
Dr. No questions so far. Dr. Ann has said previously that there are some disturbance in hearing what you're saying, but I think it's much better than how it was before. Except we don't have any questions at the moment.
Okay. Do you think the speed then, can you grab what I'm saying?
Yes, definitely.
Is it too slow?
Not really. So we haven't received any responses from the audience regarding that, and I think it's okay.
Then put the health system into the enterprise architecture context. If we want to explain a system, we have to break it down into palatable pieces, what we can understand. In view of the divisions which exist in the health system, I have drawn some arrows between them. Right? Each these division will hold a component in enterprise architecture. Right? And these relationships, how these different systems interact with each other and with other enterprises which are outside the health. Step by step, we describe the health system in forms and interact with each other. This is the mission of inter-architecture. We know the system very well. We know manage the system much better. And we can use enterprise architecture and read. Planning, describing an enterprise. If we see this sphere, the health enterprise, we can outcomes of the system. That outcome. That healthy, maybe a personal health outcome or procurement. All of this would be outcomes of the health system. If we consider in the health, many components would act together to achieve a single outcome. If we think about procurement, then there are many divisions And each of these divisions interact with each other, or they have relationships with each other. Relationships work to a business process, which is to procurement of drugs. How do departments work together by exchanging data? Right? They use different media to exchange that data. They use various techniques to get this thing done. But at the moment, they are not using computers at large scale. Right? But we know there are shortcomings. We have to but is there a single solution? Or we say that the shortcoming or the problem is right? Can we pinpoint it? No. Will be able to solve all these problems? No. But when we see something is not performing well, we tend to introduce or we computerize system. But success in the enterprise just by act of computerization is very minimal. So, what we have to do? Not just to increase the of the system by increasing computers, because that will not make the environment different. The computers will work in the same environment and the performance will be the same, that we won't see much improve the health system or the health outcome by just introducing a computer or a computerized system. Right? How do we make system? How can we improve it? To just introduce the computers, but we have to identify gaps. We have a system very big. In the previous example, we said that in order to procure drugs, we need information from different departments, and they should work together. It is necessary to exchange data between them. And exchange data, we would need some applications. It might be a paper-based, just a printed paper, or we need to some our technology. Hardware doesn't mean a computer. Some kind of a technology we will need to use. That means, send a paper or post. We can improve the system. Improve by sending a document by a fax. Even it will be a technology change. We must try to describe the system in 4 areas. We will see what are changes in 4 we can fulfill. We have to do that. We have to plan the enterprise at component level. It should be done in an understandable and manageable way. May bring us to the end of Toga. Toga describes enterprise architecture as structural components with relationships, principles and guidelines guide guide governing the design and evolution over time. It is straight away I think we cannot get much idea of it, but as we go on, we can understand what it really means. Open enterprise, or the theme of the enterprise, or how the enterprise work is described in 4 architecture subsets. They are business architecture, data architecture, action architecture, and technology architecture. All 4 of these, the main component is business architecture. I should say that all technology application and data architecture should support the business architecture of the enterprise. Then we will do the question of what is business architecture. Architecture concerns mainly about the business value of an enterprise. We mentioned earlier, health system should deliver better care to the patient, and we is the main business process of the health system. What we want to deliver to the system. Maybe patients, maybe achieve what we develop, right? In order to do that, we have to identify what are the gaps in business process. As an example, the same data by different divisions in the health system. Right? They collect information differently, or this data redundancy is due to that from single source, from a single data source, they cannot obtain information that they need to run their program. In this sense, I said that they cannot get this data to run this health program. And in business process, right? To perform the business process, we know that they need data. Right? The architecture, the 4 domains, would the architecture to achieve its state. So, the main architecture domain, as I said, is the business architecture. Business processes and activities. Right? So, from these business activities, data should be collected, organized, safeguarded, and distributed. For the applications, we need that may be from the it is not related to something not related to computers. Right? Okay, at this moment, are any queries?
There are a few questions, but I think, Dr. Subodh, we can take questions towards the end. Yes, because those are sort of general questions regarding architecture and all.
Then, we want to improve the business value. What we have to develop the of the system. Architecture of the system is described as architecture, or we have at the moment. Through a series of cases or business process analysis method, we can get an idea about the target architecture. So, the architecture will be described in first. It will be described in the business architecture. Right? It will say that we want to follow up a patient from birth. Right? It will be or improve this value. For that, we need to, that comes under business architecture. Right? That is our target business architecture. Right? To do that, we need to have a longitudinal record of the patient. They will change our data architecture from as is to the architecture. This would be to medical records which we found, and the target architecture would be a shared medical record which stores all the records of the patient. We will need certain patient architectural changes and need some technology architecture changes. Right? Thing is, how do we develop this target? How do we develop the architecture of the system? Thomas describes to use the architecture development method. It's the process which comes and goes back, and just it's go over the target every iteration through the requirement management. The first photograph ADM, or the architecture development method, is preliminary phase. In the preliminary phase, we assess the organization, find the enterprise. Then we decide what are the changes we want to achieve in the enterprise. What are the architectural changes that we need to enterprise. Once we do that, we start developing the architecture. Business architecture. In the architecture vision, there are certain things that we have to do before actually going into development of the architecture. And in phase B onwards, we start to develop the architecture of the system. We identify gaps in the business architecture. We identify gaps in the information systems architecture. Like we evaluate these gaps, and we have to the projects. Then we, as time goes on, we develop this architecture, and we implement it into the organization. And this I mentioned earlier. It's a DM helps to develop and manage the life cycle of the entire architecture, and it's the goal of the program. And execution of this ADM plus architectural resources. Then we ask the question: what are these architectural resources? These architectural resources patterns and architecture descriptions of other artifacts. In business architecture, we found the architecture target in the target business architecture. We generated some which describes the stakeholders and their roles, terms and artifacts. Right? Then within enterprise repository. And that asset or architecture resource will be available, and it will be used in a later architectural projects. Like photograph is the use of architecture and other resources that are already produced. If is there, we are not going to generate the same product again real need. Then comes the difficult part. How does architectural Photograph has provided temps that we can use to develop our architecture. Some of them include stakeholder maps. This is a set of documents, long list of documents. We have to populate it as we go on developing the architecture. We have to store them in that we can reuse them. For that, we use this in a concept called enterprise repository. This is a dual library. To make it useful to the user, there are certain tools that we have to use. The tools will these various tools can contain all these architecture resources and make them available for the enterprise architect to use them. Need is there. We have to remember all this, but this concept is very important because we want to promote. We have to identify what is the so useful of the architectural resources. So we have talked about what yoga, right? Architectural, the method for developing architecture using the ADM, and I've said that each architecture subdomain, business, data, application, and technology architectures, there will be architectural resources, and we are them in the enterprise library, and there are tools that would help us to reuse these architecture resources in the later project. To an architecture project, we have understand or we define what the project should do. This we at the start of the project we lay some guidelines, and they are called architecture principles. Architecture principles will guide use and deployment of all IT resources and assets at enterprise. This architecture principle the objectives and key architecture drivers. We have to defining architectural principles is important because there's a gap. Then all architectural work should be directed towards closing gap. It should all reflect the fulfillment of the device. And I think this brings us to the end of the presentation. And I know the enterprise architecture as a concept is not easy to understand. It is comprehensive, but the area is big. So everything is getting to keep on practice, at least practicing some of the work which is prescribed by program, and I think we have to practice architecture. I think this is my take-home message that I want to give to you. Thank you.
Thank you very much, Subodha. It was a very informative, elaborated presentation, and you really inspired the audience with your content and in pursuing concepts of enterprise architecture. We apologize for occasional disturbances occurred due to technical issues. I'm sure audience must be having a lot of questions to clarify from Dr. Subodha. Please use the Q&A button on the right panel to type in your questions. Try your best to accommodate all the questions. We can also provide facility to ask the questions using voice, provided if you have a good internet connectivity and minimum background interference. Mention in the Q&A box if you are available for connecting via voice. We will also be forwarding you the presentation done by Dr. Subodha to you after the eHealth hour. We have a few questions from the audience. I'll take them one by one. The first question we have is, are the theories of enterprise architecture currently implemented in health system of Sri Lanka? I'll repeat the question again. Are the theories of enterprise architecture currently implemented in health system of Sri Lanka? Dr. Subodha?
Yes, some of the we cannot say that these are theories, right? These are basically best practices. If we how can I answer that? Then we have to first. We have not carried out a formal architectural project in the health system in Sri Lanka. Right? And if we talk about maturity of the we talk about architecture, I can show you that slide. The architecture we call it architecture maturity assessment, right? At the moment, we are in the initial phase. Well, can you see this?
Yes, we can see.
Okay. At the moment, if we talk about enterprise architecture, we are at the initial phase of the enterprise architecture. We cannot say that we have not implemented or we don't have an enterprise architecture at the moment because we have some silos of information in different sections of the ministry or the divisions. So the problem is that they don't interact. They are not standardized, right? So we cannot say that we are not implementing any of the architecture rules, but we can rather say that we are at the initial phase of the enterprise architecture maturity.
Dr. Subodha, there's like a similar question with the similar concepts that says, what are the steps taken to implement concepts of enterprise architecture in health system of Sri Lanka? I think it's a much similar question to what was asked previously. Do you have anything to add on that, Dr. Subodha?
I think we start now. There's actually the problems. If we take a single system, let's say we talk about an electronic medical record system, right? There are conflicts in data exchange or integration of the similar medical record system in two versions, right? Version 1 will have data and information stored in that, but we develop the version 2 of the same system, that data could not be imported into the same system, right? I think even at the project level, we have to think about this interoperability and standardization.
We'll move on to the next question. This is by Dr. Hassan Kulasiri. He asks, what are the identified practical problems you have faced when you apply and implement enterprise architecture in Sri Lankan healthcare? Do you have any idea or experience on how to overcome this? The question again. What are the identified practical problems you have?
But the thing is, we have not actually gone into an architectural project in Sri Lanka at the moment. Right? I think the capacity of several prerequisites. We have to have experts, right? We have to have experience. We have to have tools, and we have definitely, and most importantly, we have to have top. Right. Together all this, I think we can implement a good enterprise architecture project in health. So, as a already Asia eHealth network has formed a regional council for regions architecture advisory council for health. And it has been formalized, but I think he will polish it soon. We can pool the resources in the region into a virtual laboratory, and we can, supporting countries, ministries, or individuals require resources and expertise. Thank you.
Yeah, Dr. Subodh, it's good that you came to the point of discussing the training and something about the EHIN, because our next question is regarding the training. It's asked by Mr. Kirti Dharmaratna. He asks, are there any training available on enterprise architecture locally and internationally? If so, how to access them?
There are several courses available internationally, right? But I think it's better to get a classroom training, because it's more or less a practical thing. And probably in Sri Lanka we can arrange training courses, but it better be done by academic program. I think you'll find trainers in Sri Lanka.
Actually, questions regarding implementation of Sri Lanka. I'm skipping, and there's another question. Is are there any policy issues with health system in implementing policy issues with existing health system in implementing enterprise architecture? Yes, Dr. Subodh?
So it is not clear. First part was not clear.
Yes, I'll repeat the question. He asks, are there any policy issues with existing health system implementing enterprise architecture in international context? If so, what are those and how to overcome them?
The thing is, enterprise architecture will not conflict with any policy, legal or any other existing practices, right? TOGAF is designed in a way that itself, or the EA practice itself, can incorporate all these existing policies in architectural project. So we don't talk about any conflicts because the policy, whatever exists in the system, are part and parcel will be the enterprise architecture project. So we don't talk about conflicts. Architecture project into the existing guidelines, that project will not progress. I think that's right.
The next question is a bit of a general question. It says, how to justify introducing a computerized system to an already smoothly functioning and running health system? To justify introducing a computerized system to already smooth functioning existing health system?
There are no gaps if the health system is delivering what it should do. Architecture, then we can say that it is in the architecture maturity is quite optimal, right? That means the system is delivering what it should be. So I'm not going to introduce any computer into that because introduction of a computer is not a part of the enterprise architecture. It is about delivering the business value. So I think if the enterprise architecture maturity is fine, there's no need to introduce any computer into that or into the system.
The next question is, what are the early frameworks other than TOGAF, and what are the advantages of TOGAF over them? Repeat the question. What are the early frameworks other than TOGAF, and what are the advantages of TOGAF over them?
There are two widely used EA methodologies. One is SACMA, another is TOGAF, and there are enterprise architecture methodologies developed by organizations like US Defense, BORDAF, and other things which are developed by individual organizations, but they are available for to use. Out of the two which I described, which I mentioned, SACMAN and TOGAF, the TOGAF training is more accessible and it is been widely used at the moment. And a community developed time-tested system, I don't think we give any preference or one system to the other. It's individual, and it's a choice that people make. So,
right, move on to the next question. It says, how often the framework gets updated, and what is the basis for updating, and how can countries cope with it? I repeat the question, how often does the framework get updated? If that is so, what is the basis for updating, and how can countries cope with it?
Yeah, at the moment I think the framework version is 9.1. I think they introduced versioning pattern, but I'm not that familiar with how often they are going to update it. But what they say is, if there's a major change, they will introduce a new version. And the TOGAF 9.1 is, I 3 or 4 years old.
All right, we have
other
one
thing is how to go.
Yes.
I think I missed one part.
Yes.
How do you country afford the version changing? Future actually the framework would be there, but there will be some improvements or additions into the steps of the process. I think I don't have experience to actually answer that question, but I don't think there will be big conflicts when adopting a new version over the older version.
Dr. Subodha, the next question, the usage and coverage of TOGAF in the developing countries at the moment. What is the usage and coverage of TOGAF in other developing countries?
Developing countries. When it comes to health system, I don't think there are major implementations. But banking, airline, and other industries have implemented TOGAF at various levels. When it comes to health, I think if the World Health Organization is just accepting or just planning to accept enterprise architecture as a strategic tool. It's about the other industries. I think if you check the TOGAF side, you can have many organizations who are contributing and adopting TOGAF as the architecture development method.
Yes, just a reminder, if you have any further questions, please type in the Q&A box so that we can forward them to Dr. Subodha. We have at the moment one last question. It says, depending on the circumstances, is it preferable to follow parts of TOGAF and later integrating all of them? A question, depending on the circumstances, is it preferable to follow parts of TOGAF and later integrating all of them?
Yes, exactly. Many of the organizations with the resources to be deployed, they first start in the business architecture and it's the same there. And they very productive outcome from applying this business architecture principles. The case of the TOGAF. Thank you.
Since allocated time has come to an end, we'll be concluding the 5th Sri Lankan eHealth Hour for today. If you have further questions to ask from Dr. Subodha, please feel free to forward them to us. We'll make sure to distribute the resource material and answers to the questions to you via email. We would be grateful if you could also submit the feedback form we'll be sending to you via email after this webinar. Please join with us for our next Sri Lankan eHealth Hour on 24th September 2015 at 12 noon. Dr. Indika Goda, a health administrator attached to Health Ministry of Sri Lanka, will be discussing on policy issues in implementing eHealth solutions in Sri Lankan hospitals. If you are an expert in health informatics and willing to share your experience with the eHealth community of Sri Lanka, we can have a session at Sri Lankan eHealth Hour. Feel free to contact us. I'm grateful for the panelists today for sharing with us the valuable information, and also Dr. Roshan Hewapatirana, CEO HISL, and my colleagues Dr. Mita and Dr. Sad, who is with me coordinating the eHealth Hour at HISL office. Finally, I must thank all our attendees from around the globe as well as eHIN for providing us with WebEx platform. See you on 24th. Bye-bye from Colombo, Sri Lanka.